So welcome back. As all of you are going about doing stories when you return to your newsroom, I'm sure that you will deal with questions from your editors about okay, but let's put some numbers to this. And I know because I used to be that editor who was asking for, some quantifiable things that we could put in stories. And so I think this is a really important session on the economic impact of mental health at work. So joining us today, we have Betsy Schwartz, who is the director of the Center for Workplace Mental Health at the American Psychiatric Association Foundation. So that is different from the American Psychological Association, where Dr. Stoley was from earlier today. She is focused on helping organizations bring public policy into action and infrastructure, including assessment of business models. And she also led the mental health first aid movement, which we heard about earlier today from one of the other speakers, as the VP at the National Council for Wellbeing. So that's also in her background if anyone has questions about that. And we also are welcoming Kana Enomoto. She is a partner at McKinsey and a director of brain health at McKinsey Health Institute. She works for clients from government entities to employers to investors to not-for-profits on how to serve people who have or are at risk for mental health disorders and substance use disorders. Previously, she was acting administrator of the Substance Abuse and Mental Health Services Administration, so if you've seen SAMHSA, and advisor to the U.S. Surgeon General on opioids. So they both have a lot of experience. They are going to talk again specifically about the economic impact of mental health in the workplace, but I'm sure can handle a lot of the questions that you're going to throw at them after this. So we'll start with Betsy. Thank you.
Thank you. It's a pleasure to be here. I have to say that just last week I was at a conference in California, and one of the speakers did a presentation on data and how to present data. And so as I've gone through and developing this presentation, I wanted to make sure that it was data heavy, but in a way that would resonate with you. So because of that, I want to start with a story. This is my friend Philip. On the right here, these are his two grandchildren and his son. And Philip was CEO of he was the youngest CEO of a Fortune 500 company ever when he was appointed in 1986 as the head of Cameron Iron. He later went on to be head of Weatherford International and several other oil companies. Each case, he grew them exponentially. And when he was 53, he walked out of his CEO suite and checked himself into Menninger Psychiatric Hospital. And he knew without a doubt that his family and the world in general would be better without him. He had been profoundly depressed for most of his career when he should have been feeling such joy because of his accomplishments. He always talked about how he didn't. Philip, 4 years after being in Menninger's, went on to be a speaker literally around the world. I first met Philip in the year 2000, and he spent all of the remainder of his life talking to other corporate CEOs about his own mental health struggles and what he found. And there's all kinds of articles. If you just Google him, you'll find articles. People Magazine did a story on him, Psychology Today. And I think it's a human face that begins to show the impact that depression in the workplace, mental health problems at the workplace are at every level and really can't be ignored. So that's my Philip story. I will say, tragically, he passed away a few years ago, not related to his mental health problem. So, but he was one of my greatest mentors, as you can tell. I am emotional just talking about it. So here's just a few statistics that I think from an employee perspective tell the story. So just last year, 65% of employees said that their mental health affected their ability to do their job, whether they were less focused, less engaged, or less productive. That's pretty profound. There are other studies that you can find that talk about when people are not engaged at work, what's behind that, and how can companies increase the level of engagement. And I'm going to go kind of fast because I've got a lot of information here, so we can come back to any of this in questions. But these are the hard numbers of showing direct versus indirect economic impact of mental health, of lack of mental health care. So lost work days, lost productivity, and turnover and overall well-being. And I'll say one thing that's not on there, but we've often heard about from the Fortune 500 companies that are working with us, is for the first time, it's not just retention, but it's recruitment. We're hearing from companies that as they're out in the field recruiting prospective employees want to know what their mental health benefits are, not just benefits as far as their health insurance, but the more intangible benefits and how the culture addresses mental health in general. And you'll see that the future disproportionate leaders, 68% of millennials and 81% of Gen Z have reported that they left their job because of mental health reasons. That's pretty significant. So from an organizational perspective, that's, the previous slide was talking about the employee perspective. From an organizational perspective, this is a report that came out of One Mind at Work just recently, a couple months ago, and it showed that 67% of global corporate leaders acknowledged that they want to and need to pay attention to mental health, yet only 1 in 4 were actually doing something about it. Yet 56% of those who were doing something formal and a real formal strategy were showing a higher impact of their programs. So if you remember one thing from everything we've said, it's that creating a mentally healthy workforce is not about a program, it's about a culture. And creating a mentally healthy culture and an environment of well-being is a comprehensive strategy that I'll get to in just a second. But this is kind of at a higher level of saying, I'm sure you've already heard the statistic, that 1 out of 5 Americans have a mental health problem, and yet only less than half of them ever receive care. Yet 70 to 90% get better. And I put this little cancer note on here, not to imply that oncology isn't a successful field, but mental health care often gets a bad rap of people saying, well, part of why I'm not going to access care is because it's not really effective. And that couldn't be further from the truth. I think there's been so many advances in brain research and in the treatment of mental health problems. And just to give it some kind of comparison, that if you look at all forms of cancer and all the innovation in cancer care, it's still only 68% effective in survival rate. So just last week, actually 2 weeks ago, the Gallup poll came out with a survey that some of you may have seen in the media that showed that 1/3 of US adults believe that mental health issues are handled worse than physical health care. Well, that could be controversial, but if you really think about it, that is a reflection of the statistics that I just mentioned. Because if people have difficulty finding a provider, because there is a huge workforce shortage of mental health professionals in the US and actually globally. So that plus the affordability of care and the lack of insurance coverage is part of why people are so frustrated. I think, I'm sure you've talked about the fact, especially since COVID, that people are much more willing to admit that they have a mental health problem. If COVID did one good thing for anybody, it's that it really did begin to normalize the experience of struggling with anxiety or depression. And because of that, more people are actually seeking care. But is the care available? And I think one of the solutions, I'm going to come back to this in a second, but one of the solutions for finding mental health care means that companies have to be less traditional. So these are some companies: American Express, Goldman Sachs, Bank of America, Mars. I could list another 10 that are companies that have comprehensive wellness structures and programs, a whole continuum of programs in place that do create a culture of mental wellness. Some of that is that they're replacing what were traditional EAPs, not to say anything wrong with EAPs, but traditionally the utilization of EAPs has been lower than most people would like it to be. And that's because of, obviously, people are afraid to access it. Yet a lot of companies are replacing EAPs with broader options for care and treatment. They have on-site counseling, which is obviously an easy way for people to get care. They're contracting with companies that have a lot of different options. It's not just one size fits all. It's not just counseling options. And they're using collaborative care. So I don't know if any of your other speakers have talked about collaborative care. We can get into that more in the questions, but collaborative care basically means that your physical health doctor and your mental health team are all connected, and you don't have to go to 20 different doctors to pay attention to your mental health care. And there's also a lot of research that shows what is basically common sense, that if your manager, if you have a good manager that you like and that pays attention to your well-being and that understands signs and symptoms of when you might be having a problem, managers have a lot to do with the culture of a workplace. And so at APA Foundation, we've created a program called Notice, Talk, Act that's very brief and only focused on manager training, because we want managers to have a quick, easy way of increasing their knowledge about how to recognize an employee that might be struggling and how to feel okay having a conversation with that person. So what can journalists do? Well, obviously this could be an hour-long discussion in and of itself. I think you could tell me the answer to that. But the 2 points that I'll make is the fact that, as you all know, language matters. You know, it used to be, and I think there's been significant improvement, but I remember I'm old enough to remember in the olden days when a title would say schizophrenic does blah, blah, blah. Or so the language of people first, and realizing that you wouldn't say a person that's cancerous, you would say a person suffering or living with cancer. So the same is true for mental health conditions. The way you write, the way you tell your story can make a difference just in the stigmatizing or lack of stigmatizing use of language. And just as a side note, I try to forever remove the word stigma, because I think, as Samsa thought and many people say now, is that stigma in itself is stigmatizing. Like, we don't use the word stigma in any other disease. And so really we talk about fear and misunderstanding, because that's really what it is. So, and the other point that's so important is conveying that treatment works, looking at all the research, doing your homework, and finding out the efficacy of treatment, and realizing that it's a lot different today than it was 10 years ago. And you can really have an impact on how willing people are to seek help by conveying that, in fact, treatment is an option and it does work. So that's my overview. This is our mighty but small team at APA Foundation, and we'll come back to questions after. I think And we do questions.
I'm over here.
Oh,
Yes.
okay. I'm looking for you.
We'll do it after
Okay.
after Kana.
Well, I'm Kana Enomoto, and great to talk with you all. I'm going to start by asking you guys a question. How many of you work for an employer that has a mental health or wellness strategy? No, American journalism is suffering. So only a handful of you actually have are working for a company that has a strategy. How many of you, or maybe just shout out, like what are some of the activities that your employer does that you think are sort of like to have a mentally healthier workforce? ERG. Yeah, affinity groups, places where people can get mutual support. That's good. Other things?
We do a fitness benefit. So, yeah, gym membership.
Like supporting a gym membership. Yeah, yeah. Other things?
I think they started bringing puppies to campus sometimes.
Oh, now that might actually work. That's
Sometimes businesses too.
okay. CNN.
Yeah.
Everybody. That's great. Other things? And now, I know none of you would say this about your current employer, but how many of you have ever had a bad boss? A lot more people, right? And so what we know is that there are a lot of great things that companies do, like paying for the gym or bringing puppies or, teaching yoga classes at lunchtime. And yet they sort of sometimes turn a blind eye to the toxic workplace factors that are happening. And it's really, people don't quit companies, people quit bosses, right? They don't quit their job, they quit their boss often. And so what our research has found is that in some ways these are related but independent factors, right? Your well-being and your health is one thing, but you can actually be fairly well, but really be suffering in the context of your workplace because it's not a healthy culture, or you don't have a healthy amount of responsibility for the resources that you have. And so employers really need to do both of these things. And about 3 billion of us on this planet work for somebody else. And so there's that much opportunity for people to, for organizations to address the well-being that people experience on Earth. So I'm from the McKinsey Health Institute. We are some of you know McKinsey? Many of you, everyone knows McKinsey. I'm not from that part of McKinsey. I'm from I work at the McKinsey Health Institute. We are a non-revenue generating entity within the firm. Our work is not commissioned by clients. And we are an entity that was founded on the belief that we could add 45 billion years of higher quality life to human existence. And so that's about 6 years for each of us. And that means not only extending life, and some, depends on, country, geography, income level, but in some places it's extending life, and in many places it's increasing quality of life towards the end of life, because for as much as life expectancy has grown over the last 100 years, the proportion of life that we spend in poor health is about the same. So we live longer, but we live the same amount of our lives in poor health. And so we're looking at different sectors, different factors, different environments that can affect that human well-being globally. And so workplace is an important factor, and then mental health or brain health are also important factors. And so this conversation brings together two of our important focus areas. The way we think about health at McKinsey Health Institute is not completely unique, but sometimes it is provocative. We consider not only physical health, but also mental, social, and spiritual health. And spiritual health can mean religion for some people, but for many people it means a sense of purpose, a sense of belonging and connection to others, a sense of having a purpose greater than oneself. And for a lot of people, that purpose comes in their work. I mean, I think journalism, not everyone's doing it. I know you're all getting paid very well and have very glamorous jobs, but some people do it for the love of journalism and telling the story, right? So there is a purpose in the work that you do, and sometimes that it can be part of people's spirituality. And so this is how we think about health. There's personal behaviors, there's sort of personal attributes, our genes, our heredity, there's our environmental attributes, where we live, how we live, and then the interventions that we do. So healthcare is only a tiny slice, as most of you probably already know. Like, healthcare is only a tiny slice of how well we are, of our health. And we know that strong, employee health can vary across the continuum, obviously. And we did a survey last year of 30,000 people from around the world, at least 25 countries. And what we found was that about 57% of people who were employed said that they felt like they had good or very good health across all 4 of those dimensions. So we would call that good holistic health. So that means almost half of people, or a third of people, don't feel like they have good health across at least one major dimension that brings them down. And importantly, around the world, 1 in 5 people are experiencing symptoms of burnout. And burnout is different from health, right? So burnout is exhaustion, mental distance, cognitive impairment, emotional impairment. I don't know if people have ever felt like at some point you just you don't feel emotionally engaged in your work. You're kind of not feeling as motivated as you used to be, or not feeling like it has a purpose as much as you did at some point. You're kind of going through the motions. That's when people are at risk for being burned out. And what we have looked at, we were talking about, I was mentioning there's multiple dimensions of this. So the people who are, both having positive health, right? This is the holistic health dimension. This is the burnout dimension. And so there are, high burnout, low burnout, good health, poor health. So the people who are doing well, who have both low burnout symptoms and positive health, is about 50% of people. And then we're saying that the people who have poor physical, mental, social, spiritual health, and high burnout, these are the people we would say are in that drowning category. Right? So that's like 1 in 6 people is feeling like they're drowning, like sort of a lot of things not going well for them. And then we have the other 2 dimensions. And so what we've identified is that employers need to do both of these things. They need to address both of these problems at once in order to really get that thriving workforce that's faring well. And what we call this is 51%, like who aren't here, that's an opportunity, right? And it's a little bit different from who's like, what's the cost of having people who have mental illness in the workplace? It's really what is the opportunity if all of us were firing on all pistons, right? So we're a little bit, we're on the maximalist side of we really not only do okay, but how can we do great? And so when we look at if we could improve attrition, right? Like have less people leaving the workforce because they're not feeling great or they don't love where they work. If we could have less the absenteeism, the presenteeism, those are sort of no-brainers, but then increase productivity. If people are performing optimally, right? What would that give us? If we could retain people who like where they're working, not only because they have great purpose, but because they're taking care of their employees. And then we're attracting the best talent. And that's a virtuous cycle. If we attract the best talent, we keep the best talent. It makes more fun for everybody else to work there. And then these are right, the costs of poor employee well-being, those are those ones, the benefits of having positive well-being. And what we estimate is that there's $3.7 to $11.7 trillion of value, which could be gained by investing in optimal employee health. And what that would mean, so like that's just like suspend disbelief, like throw out the laws of gravity. If we did this for everybody everywhere, that's what we could get. But even if we did 10%, if we could get 10% of that, that would unlock $1 trillion of annual value and raise global GDP by 1%. Right? So we don't have to go the full like way all the way to 11.7. If we just did 10% of employers could get their employees to better health across both dimensions, we could unlock 1% of global GDP. And for every 1 to 3% increase in global workforce participation, you get another $1.4 billion to $4.2 billion in GDP. So there's a lot of benefit to investing in this, and as we look to going to thinking about the concept of brain capital, this employee health, employee workforce framework is really important, because we're relying less and less on industrial capital and more on technology and other things. How we think, how we feel, how well we're performing, that's going to be really important. And so what are some of the things, what are the enablers? In addition to puppies, I love the puppies, but in addition to puppies, and actually, if you think about puppies, like they do a lot of things, right? Like they encourage social interaction. They're getting people to think a little bit differently about how their work is. Like, this isn't just a place of torture. This is a place where I can enjoy and feel a sense of community. I can recharge and have more energy for some productive activity, managing stress. Interestingly, on mindsets and beliefs, companies that have a very clear sense of purpose grow at 2 times greater rates at companies that have a less clear sense of purpose, where their employees can't identify the purpose. So that purpose is really like rocket fuel into the engine of a company and its growth. But it's something that some employers overlook, in terms of, like, we think people are just going to come do their jobs and all things are the same, but it's not. When people are motivated, when people are engaged, they work harder, they work more, they work better. Economic security is an interesting one. After a certain point of being able to meet your basic needs, the economic return of your employment doesn't make as much difference to you. So it's like, I'm not necessarily more satisfied or less stressed if I make more money after a certain point. Obviously, people meeting their basic needs, that is a sort of obviously important level to reach. Otherwise, people do feel an undue amount of stress. And then sleep. The average cost of people that have insomnia is like over $2,000 per employee per year, because of lower productivity, more absenteeism, et cetera. So sleep is extremely important, and an important factor, well, for so many reasons, for your brain, for your health, and other factors. And if you take nothing else away from this conversation, I hope you think of health, employee health, as a strategic imperative for companies. That when a company decides to do this, has to be an organization-wide thing. It can't just be a pocket. It's not just one. It's not just the ERGs. ERGs are great, but it's ERGs in the context of other broader initiatives. Invest better, not more. Right, so having lots of point solutions, like I can have this digital technology thing, I can have this app, I can have this, weekly yoga class. Like, we are not going to yoga our way out of this problem. We need to have broader science-based, data-driven strategies, and then holding leaders accountable to outcomes. Right? I think as Betsy was talking about a CEO who's had their own struggles, what we have found is that a lot of employees feel much more motivated and understood if they have leadership from the top explaining, especially about mental health, but overall health, where leaders are willing to talk about their own vulnerabilities, where they are encouraging of that conversation in the workplace. Because a lot of employees still feel like they are not safe to disclose that they are experiencing any of these challenges to their boss or to their coworkers. And Betsy was talking about language matters. I was at SAM, so we took the word stigma off of everything, because no one, if someone said to me, how do you deal with the stigma of being a woman? I'd be pretty offended, right? But somehow we're like, okay, how do you deal with the stigma of having a mental illness? Right? But it's just as negative. And I think that leaders can set the stage for saying, I need mental health days, I got treatment, my family member got treatment, and just as you would send flowers or a casserole for someone whose child broke a leg, you could send flowers or casserole for someone whose child went into rehab. And it's not scary, it is normal. And it happens to, almost all of us. So, all right, thank you.
Questions? Yes.
Can I just add one thing? I have to say this when Kana mentioned the idea of bringing a casserole. I recently heard somebody, I don't know if any of you've ever been in a therapist office where they give you the back door to exit. Like, God forbid you should see someone in the waiting room. Like, if you went to your whatever fill in the blank doctor, would they have a back door for you to leave from?
Regarding language, besides, in media coverage, besides referring to a person, like as their condition or disease, are there any other like editorial choices you commonly see journalists like still making that you think are harmful for, understanding mental health and like the importance of workplace mental health?
Well, I think some of it relates to the efficacy issue of implying that help, so and so needed help and it didn't work, instead of telling the success stories. So, Kana, I don't know. Can you think of specific words that are harmful?
I got a whole list of them. I do think the Carter Center's work on this is excellent. So assuming you guys have heard from them or talked to them, but they have a whole guide for, like, for example, how to talk about suicide, which I think a lot of,
Right.
I've seen a lot of progress on that, right? Like, we don't commit suicide, we die by suicide, et cetera. I think some of the words that are like suffering, afflicted by, right, sort of things that imply that it is inherently a very negative thing to live with. We don't necessarily, we won't say afflicted by HIV anymore, right? Like, people live with HIV as a chronic condition. People can live with schizophrenia as a chronic condition. Not that it doesn't have acute stages, not that it isn't a potentially harmful and life-threatening condition, but I would, the guide that I would use is what I talk about what I talk about diabetes this way.
We'll be talking about this a lot in the next session, and actually one of the panelists in the next session worked on the Carter Center's guide, so she can also talk about that, but please continue.
Sorry, I just had a follow-up. When you mentioned the example of like some therapist's office having a door, like, that people can like escape through the back, and how SAMHSA has taken off the word like stigma from their editorial content, but I understand like the importance of that, but I also know that like the fear and like misunderstanding that people have around mental health like is one of the things that like makes it hard for so many to get mental health care, and that some people might appreciate being able to like leave through the back door. Like they might, like, I know some people who are more willing to like get care if they know it can like be like on the down low. So I was just wondering like what you think the balance is of like helpful versus hurtful.
Well, I think as we can normalize mental health care so that it's no different than going to any other healthcare professional, that will go a long way. And that's what I was saying, I think post-pandemic, it's because the prevalence increased so much because of during COVID and after COVID that it became more acceptable. And so it's only going to happen when we think of mental health problems in the same way that we think of any other health problem.
I would add, so we reduced the use of the word stigma while I was there. Didn't mean we pretended that people didn't have negative attitudes or discriminate, right? So it is, there's full acknowledgement that happens. It's really, there's this gentleman named Harold Mayo, and he was an editor, or I think he still is. He lives in Florida. He would email us all the time. It's like every time he saw something in the press, he'd say, "You use the word stigma, and here's why that's wrong." But the way I think about it is, if I'm talking to Blanca, and she's saying, sorry, I don't have my glasses on, and she's like, "How do you live with the stigma of being a woman? And how do I live with the stigma of being a woman, or whatever I am?" The problem is probably not with the womanness, right? It's in your perception of it. And so when you use the word stigma, it seems to place the blame on the individual, but it's really on the part of the perceiver, right? And so that's why we use words like prejudice and discrimination, right? So how do I deal with the prejudice that is launched toward me as a woman or as anything else? That's a different thing. So that's why we change the words, but it's not to change the idea that there are people that feel ashamed, that will actually experience real consequences, institutional discrimination or prejudice as a result of having that information out in the public. So privacy is still important. Choice is absolutely important. We're not trying to out anybody. in that way. But it's really more about placing responsibility for those negative views with the holders of the views versus with the condition itself.
So two questions. One is, can you talk more about digital point solutions? I'm actually not super familiar with that term. And then my other question is, how do you kind of, I guess, separate like work life, issues and health? Because I've been in journalism, I guess, like 20 years now, and I feel like the further along I get, the better I am at separating like my personal satisfaction from work satisfaction and identity, and like I feel like that's a healthier way to deal with work stress than like, I don't know, associating all my life with it. So yeah, if you could just kind of talk about like, because I feel like we're conflating a lot of like, are you happy? Are you healthy? You know what I mean? And these are like much bigger questions than just like your work life, I think. But I'd be curious just to hear what your perspectives are on that.
Well, obviously, when we show up at home or we show up at work, we're the same person. And so, as we get a little older, perhaps we're able to compartmentalize one from another so that the part of me at home that's stressed out about a sick child may not be as present when I go to work. But it's still the same person. And actually, we're doing some work right now around what corporations can do to support caregivers, because most employees are caregivers, whether it's for parents or children or whomever. So it has to be really integrated from a policy perspective. There was something else I thought of as you were talking, and now I lost it, so it'll come back to me. Kind of go.
Let's jump in on digital point solutions. How many of you have heard of Calm? Headspace, Doctor on Demand. Those are digital point solutions. So the apps that you can download that pretty much do one thing. Right, so I have like a whole folder on my phone which is for like health, and it has like 25 things in it. So those are point solutions, and the reason we refer to them as point solutions is they're not necessarily like end to end, your entire healthcare journey. It's usually like my diabetes blood sugar diet monitor, app, or my exercise tracker, and
just last week, I heard some speakers from the Stanford Innovation Center talk about the role of AI in mental health care, and it's mind-blowing. I mean, you can find a lot online, but everything. One of the things that I thought was so interesting is they were talking about how AI can triage a clinician's waiting list, and and the other part related to COVID is that telehealth became so much more common. And so now a lot of therapy can be virtual which makes it a lot more accessible. And people are training people who are not clinicians to be able to provide short-term counseling.
Yeah, and mental health is different from physical health. So I was just looking at some data in 2023, 43% of psychotherapy was delivered virtually. And less than sub 10% of primary care was delivered virtually. So mental health had a huge spike during COVID, went up to 70% in 2020, but has like leveled out at 40% plus since then. And then on your question about sort of separating self and work, I think we probably exist on a continuum of that too. Right? Like I think some people very much find their identity and their purpose in their work, and other people are like, that's my job, this is my life, like my life is where I live and that is where I work, and we have different abilities to compartmentalize or where we find satisfaction. I think that what we do know, however, is that it's pretty hard if you have a very negative experience at the place where you're spending 8 hours a day, and it's a toxic environment, to keep that from bleeding over into other aspects of your life. So feeling really great in the rest of your life doesn't solve that. And sometimes that can bleed over into your sleep, into your diet, into your relationships, because something elsewhere is really bothering you. So.
And I just want to add to it, I think it was really important when Kana used the word thriving, because there's a lot of research now speaking to the fact that it's more than wellness at work, it's about how does an employee thrive. And thriving comes from connection to other people at work, finding meaning, being inspired by the work. All of those levels of engagement impact one's ability to thrive.
I'm curious about whether companies are really kind of digging into utilization and why it's low. I know confidentiality is often the reason that's cited, but I'm wondering if they are jumping to these digital point solutions. Is that an easier thing to do? Are they really looking at why utilization of EAPs are low before they do that and figuring out if that's the best solution for both of you?
So some of the newer entrants into the EAP space, like the Lyra Spring Modern, they would say they have much higher utilization. They have like 2 to 3 times higher utilization than traditional EAPs. They are probably doing a better job at engagement.
Sorry, what model was that?
So there's different companies that are what we would call next generation EAPs, employee assistance programs, and so examples of that are Lyra Health, Spring Health, Modern. And so they are more digital platforms that are providing evidence-based psychotherapies to self-insured or fully insured employees. But I think, there's a sort of shocking amount of people getting psychotherapy and getting treatment nowadays, especially if you look at Gen Z. Fully 25% of Gen Z that we surveyed in the US say that they've been diagnosed with a mental illness and received treatment, which seems very high, considering that's about the prevalence rate that we expect it to be. So it's probably not every single person who needed treatment got treatment, but I'm not exactly sure what they're calling treatment, right? We don't know that. But as we get to younger generations, there is much higher utilization. And over the past few years, employers have seen utilization of outpatient mental health services go up. So where stigma, confidentiality, mental health literacy fall on that, I'm not exactly sure.
I'm sorry, really quickly follow up. I think, Betsy, you had also mentioned on-site counseling, and I was curious how that differs from a traditional EAP, or if you could just elaborate on that.
Well, there's a long history of EAPs, but originally EAPs were on site, but that was a very long time ago. But now, in the last 20 years, most companies have outsourced their EAP. So if your company has an EAP and you call this number, then you get a certain number of sessions with a therapist, versus if your company has a therapist that's literally on site.
And some of the next generation EAPs would say the benefit of going to those outsourced resources is that you can get a better match. So some of them use algorithms, tell us a little bit about yourself, what you're experiencing, what you're looking for, what your preferences are, and then we can match you with a therapist that better meets your needs, versus the one who's on site is the one who's on site, and so you could go at 11 a.m. or 11:50 a.m. or 12:50, and that's the person you get to see.
Well, and somebody might also feel more okay about going to somebody off-site, even though we don't want to call it stigma. The fear and misunderstanding is there.
I wonder if anybody's looking at the kinds of therapy that could help. For instance, is it CBT? Is it talk therapy? When do you know if your therapist is good or bad? Should you have a prescribed number of sessions? Or I've heard people going to therapy forever. So is anybody looking at what works specifically for the workplace that we can count on, that we could check boxes?
There are a lot of people. Yes, there are many people looking at those questions. There's new research coming out about single session psychotherapy, where people can actually find a significant amount of relief and positive outcomes after just one session of problem-solving focused therapies. There are therapies now that are sort of transdiagnostic, where you're able to do one type of psychotherapy. It can address multiple conditions. It's not just a depression therapy or an anxiety therapy. But then there are also really fantastic evidence-based therapies for specific conditions. And how many sessions, dose and duration will depend on the severity of the condition and the kind of the course of treatment. But there's a ton of research about what works for whom and when. The trick that we have is, how do we get what works to the individual at the time that they need it and ensure that it is covered. So we haven't perfected the system, but there's a lot of science, just like fantastic science. A lot of it coming from Betsy's members or the APA's members, American Psychological Association members, others who are doing really great research in this space.
So who are the specialists in the one session?
I'm happy to send you some papers, references to that after, but yeah.
And it is a very significant personal relationship. So, it's not just one size fits all. I think it really depends on the individual.
I have a slightly self-serving question for Kana. I'm working on a story for AARP's magazine about surprising things that age you. And I saw at the beginning, of course, you talked about how your foundation or organization is involved in longevity research. Do we know anything about, clearly like stress ages you from the cellular level, and stress at the workplace, that's not entirely surprising, but do you have any links between like toxic work environment and early death?
Oh, well, that's very specific. I was like really excited to talk to you about Andrew Scott and his work on health economics. But toxic work environment and early death. I don't have anything specific to that, but there is some fantastic work that's happening on longevity. We really need to change our language about aging. Because we think of we used to like AARP. I was so annoyed they started sending me stuff at age 50. I was like, what? This is rude.
I agree.
No offense, but but because people live longer, can be well longer, our expectation for how productive and engaged people are at different decades of their life, needs to shift as a society. There's so much value that we have there. And so we just, at McKinsey Health Institute, just hosted Professor Andrew Scott from Oxford University to do a talk with us in New York a couple of weeks ago, and it's just fantastic how the longevity space is. I think his the 100-Year Life is maybe his book. So it's really interesting work. But yes, so he has some pulled together research that's fascinating that I highly recommend.
Hopefully not a difficult one. Betsy, you mentioned mental health manager training, and one of our other speakers brought that up as well. And I was wondering if you could speak to the kinds of organizations that have adopted that training, big, small, what kinds of impacts they've seen, and any kind of resistance and pushback that you've seen from businesses in adopting that kind of training.
So I'll speak from the training that we currently offer at the APA Foundation, which is called Notice, Talk, Act. And it's a 35-minute video that is about to have an in-person option afterwards. And then quasi off the record, I think, when I was running mental health first aid in the US, and this was probably, maybe 8 years ago, and I would go to corporations and try to engage them in having mental health first aid available for their employees, and they were not interested. And the reasons were all over the place, but I think some of the reason was because they were afraid of opening Pandora's box. Like, what are we going to find if we do this training, and people are going to just start using benefits, and they're going to, it's like, and post-COVID, post-pandemic, it's a complete different story. Companies understand that it's costing them money if they ignore it, and they understand that people need help and can get help, and it's very different. our program specifically, if you can research, there's a lot of data that shows, as Kana said, people don't leave jobs, they leave managers. And that's why it's so important to train managers to be able to recognize when an employee might be struggling with something and know how to have the comfort level to be able to talk to them about it.
Any other questions?
I do have another question.
Wait.
Can you talk again? We've talked a lot about EAPs today, but I'm just kind of curious. I feel like mental health has become a much bigger conversation in the workplace and even in journalism. But there's still this idea of just ask for help and then everything will fall into place, right? And we had a speaker earlier who was kind of talking about how great EAPs are. So is there evidence about effectiveness, or how do you gauge effectiveness, or I'm just curious about that.
Well, there is research about the effectiveness of therapy and the different kinds of therapy, and specific to EAPs. That's another. There is research about that, but I think the point is that help is available. The APA Foundation just created a nationwide public awareness campaign called Mental Health Care Works. And if you go to the website of Mental Health Care Works, you'll see personas of people with different types of problems and a way to get help. So, we're not saying that it's not hard to find the right kind of help. It's always not always easy, but help is available. And we want people to make that first call and realize that they don't need to struggle in silence.
Yeah. I would say EAPs do not equal mental health services, right? So EAPs do many things. I called the EAP to help me find caregiving for my older adult parents, right? You can call the EAP to get, some intermediate estate planning advice or legal advice. So EAPs have many functions, and so I think there is evidence for employers that employees find EAPs useful. They are a retention factor, right? So that's the point of an EAP, right? EAPs aren't necessarily meant to make people healthier, but they're meant to make employees a more attractive employer of choice. And then one of the things they do is often mental health or substance use services. Again, you remember EAPs have a long history. So EAPs were born and had mental health and substance use services before parity. So before they were required to include mental health services in their health plans, they had EAPs. And so now we have two ways. Now we have multiple ways for people to get access to mental health services. In some, it's the EAP, but then it's also part of the health plan. And so people go from their EAP counselor, and some companies that run them say, oh, well, we also partner with your health plan, so you can do 6 sessions with your counselor as EAP, and then we'll go start billing your insurance if you need more services after that, or else you have to switch. So it's just, I would think of an EAP as a delivery mechanism for mental health supports. And then, your health plan is another one. You can go in your community if you don't want to do either of those things, right? And you can go direct. Now we have so many opportunities for people to go, direct to consumer. You can go online. You can do Talkspace. You can do all kinds of things. And I think we are maybe glossing over the fact that it is not a panacea. It's not oh, just go to your EAP or go to therapy, then you're happy, and it's work. There's a lot we could do to be preventing some of these issues before they happen. Some people have really complicated lives and they do amazing things, but still carry around them, trauma and social challenges and violence and other things that they've been through, and that's hard. And so it's not you snap your finger and it makes it all go away, but it does help to feel like there's somebody on your side and you have someone to talk to, and there's a place where you feel understood and you can learn some new skills to deal with the stress that you have.
Yeah, I mean, I was talking with some other fellows last night about like maybe if you just gave someone a raise, they would feel better, right? like instead of being like, here's an app, like here's more money, right? Like I don't know. I mean, I guess that's kind of a skeptical comment, but like it also feels like yes, like maybe just make your working environment much better.
Yeah, that's why it is. Well, like our research shows that it's not hydraulic. It's not like, oh, we helped your mental health and now your toxic boss is less annoying. Like, no, your toxic boss is still a toxic boss, but now you have better tools to deal with them. Like you have to address both of those things. Getting the raise, though, I think the research shows that that's not. Again, above a certain level, right? Like I have enough money to pay my bills, to meet my obligations. That is absolutely crucial. And then, but like incrementally above that, you don't see as much gain as you think you might in terms of, how people feel belonging or satisfaction at work. I think they feel more belonging and satisfaction if they have colleagues that they consider friends at work. If they feel recognized for their contributions, they feel like they have the tools and the ability to make a meaningful contribution at their work. I think those are the things that drive satisfaction more than compensation. Again, as long as like we're being paid a living wage and can do what we need to do.
And one other point that we haven't talked about, which is most people work for small businesses, and the whole dynamic around small businesses is an important conversation that we'll do next time.
Betsy, thank you so much.